From patient to purpose, survivors leading the change. Together we fight, together we win. From diagnosis to recovery, from fear to fierce advocacy, Nigerian cancer survivors are stepping into purpose. This is Cancer Watch, and today we meet two women turning their stories into systems of support for others. My name is Dr. Denise Ejo, and I say again, hello and welcome to Cancer Watch, a platform powered by the Common Cancer Foundation in partnership with the Association for Radiation Clinical Oncology of Nigeria. Proudly brought to you by Plus TV Africa. This month, we've celebrated stories of strength during our Cancer Survivors Month, and today we bring it to a powerful close with this edition titled, From Patient to Purpose, Survivors, We Are Leading the Change. And with me in the studio is my one and only co-host, public health advocate, and media personality. He's become media personality on this journey. Olutunde Olusegun. And he's representing our partners, Arcom, and my personal person. Dr. B.
Hiya. Hello, Dennis. Thank you so much for that brilliant praise. Always, you're very generous. And the month of June has been Survivorship Month for us, and we've been focusing on that, like you said. And it's a very big honor to close this meaningful month with two remarkable guests. Firstly, we have Mrs. Mary Gloria Orji Nwadiogu, a 15-year-old survivor, two-time breast cancer survivor, and president CEO of the network of people impacted by cancer in Nigeria. Gloria is a powerful advocate creating a nationwide platform for survivor voices. And also joining us is Nurse Esther Dunia, a registered nurse, midwife, and perioperative nurse with over 23 years of hospital-based experience and more than 15 years in the public health sector. She was diagnosed with stage 3 HER2-positive invasive ductal carcinoma, commonly known as breast cancer, in 2023. And she is a survivor who brings both compassion, clinical insight, into women's health and cancer advocacy. And with these women, together we fight and together we win. So sit back and relax and let's start the conversation. You're welcome, ladies. Good to have you here. Esther and Gloria.
Good afternoon. Thank you for the opportunity.
Good day, Dr. B. Thanks for having us too. We love being here.
Thank you, guys. So now, viewers, sit back, relax, and let's start this conversation. And I'm going to start this question with Esther. Can you take us back to when you were diagnosed? Do you remember about those early days? Let's put it like this. Early days, they still remain early years. And how did that moment change your life?
Good afternoon, everyone. My name is Esther Dunia, and I'm a cancer survivor. Back in 2023, I went for a hospital visit because I was feeling unwell, and I ran some tests and asked to come back the following day. While doing the review with the doctor, I remember that I had a sharp pain on my left breast, radiating to my left arm the previous week. So I requested for a mammogram. And I did the mammogram. And the result came back inconclusive. So I was asked to come back the following year. But I asked to see the radiologist and ask what the next step will be so that I'm sure of what the problem is exactly. And he suggested I do an ultrasound, which I did. And after the scan, the radiologist suggested I see a doctor because what he saw on the ultrasound was not something that was, that I need to sit on. I need to work on it as soon as possible. So The following week, I was able to see the consultant and he suggested a biopsy. To cut the long story short, the biopsy result came back and I was in stage 3 of breast cancer, which is surprising because the previous year, October, the pink October, I had actually gone for examination and nothing was found. And I also do self-examination, but within January to March, something happened. So after collecting the results, the whole world just came, tumbling down. I denied it. I was in denial for a short time, for some period. But then I knew I had to discuss with my husband and my family so that we know the way forward. On discussion with him, and he said, no problem, we're going to get through this. And the journey started. I went for a CT scan, all other investigations that were I was asked to do, I did those. Unfortunately, at this point in time, I was in the process of retiring from service. So the way money was going in and out was something that actually caused a concern for me because here I was getting into retirement and having to carry the burden of cancer. So, but with family, my husband was very supportive. My children, being adults, I had to let them know what was going on. And going forward from then, during the treatment chemotherapy, they saw a mommy that was up and about, that could work till 1 a.m., go to sleep and wake up by 6 or before 6, to somebody that had to be helped from the bed to use the bathroom. But thankfully, in the process, I met some champions. Thankfully, Nipissing, one person met me in the hospital and she asked if I belonged to Nipissing. I said I did not know what that organization was. And she said it was a support group. And also have been in the cancer HIV prevention space, I knew the importance of linking up to a support group. So I joined. And that was, yes. So I joined the support group, and from there, things started changing. Because at some point, I was getting into depression. I didn't want to talk to anybody. Most times, I preferred to stay in my room, not even my sitting room. I was not going there because I didn't want somebody coming to say sorry and then setting the fireworks off. So I just kind of pulled myself out of communication with everybody. But thankfully, when I joined Nipissing, things started turning around because I found out I had purpose. I saw people like me in the clinic, and I knew I needed to do something different. So I keyed into my past experience as a nurse and started talking to patients. I started recruiting them into the platform, and that gave me purpose. And so with my family support, they've made things easy for me. My husband was supportive during those days I couldn't sleep. And he would be the one to stay and watch over me. And then my children also, they were up. They come in to ask, Mommy, are you doing okay? And then my last child, who is still with me, had to become my chauffeur, taking me to and out of the hospitals, and then whatever drug I needed to buy, because everything we did was out of pocket. So whatever we needed to buy, if it's not in the hospital, you go look for those drugs. So my family has come through for me, and the community where, friends that eventually came through for me. But more importantly, I found a tribe that understood my language, which is this cancer support group. So I'm very grateful to Nipissing give me this opportunity.
Thank you. Yes. Really, really, really good to hear that, because that's, I think, what we're all about.
And Dennis, it's interesting how no matter how many times we interview people, you just keep hearing about what a shock it was, how difficult it is. I mean, the stories can be different, but then they also have so many common pathways that they follow: misdiagnosis, delay in diagnosis, paying out of pocket, recurring problems that are just going on and on with everyone we see. And in her story, we can see the story of everybody. But thankfully, she was even in the health sector. I think it helped her to actually galvanize into action and get things done to a point where she even started her treatment. And it's just lovely. Thank you for sharing with us, Esther. But I'd like to go to Glory right now, and Esther has shared with us some of her motivations, but a lot of people, and this is something that happens a lot, where people don't talk about the disease. People living with the disease hide and walk away from it. They just go silent. But both of you chose to speak up and lead and advocate and form a tribe and be tribal leaders. What moved you to become a voice for others, Glory?
Thank you, Dr. B, for that question. Actually, that was what made me to become an advocate. In 2010, when I was going through my treatment, that was when I was diagnosed. And I remember whenever I walk into a clinic, everyone seems to be in his or her own world. Nobody discusses with the other person. There was this fear that is inside, and nobody knows what that fear was all about. Nobody can penetrate it. And I discovered that whenever I start talking to one person beside me, and I'm like, sharing my experiences and stuff like that, whenever I start doing that, you will see 2, 3, 4 patients, even those that are a bit far from me, you will see them bending towards what I was saying, Then I knew that there was a need for cancer champions to come together and talk about this. That a lot of us had questions, had fears, had anxieties that we couldn't voice out. It meant that a lot of cancer patients were lonely, even though they are surrounded by family. And so that was what propelled me. That was just the passion. And I realized that because of the stigma associated with cancer in our community, in our country, the religious stigma, oh, you didn't do enough in the church, you didn't donate enough money, that's why you're having this, oh, it was because you're a bad person, kind of, it must be your fault that you have cancer. So those things make people that even have cancer don't want to talk about it, because definitely you are the reason. Something negative about you made the cancer come. And so the group, that silence that needs to be, will I say, needs to be broken out of whatever it is, was what made me to form this community.
Thank you, Gloria. Thank you, because, whenever I hear this thing, and I try to say to people that I think our strongest strength is in us, because the stigmatization, the fear, I always think as fear as the biggest one. And it makes me always wonder that everybody else has their own issues, but we have ours that are very unique. When Esther was just sort of explaining about hiding herself in the cupboard in the room, it's our reality. And yet we have to come out, because if we don't come out, 10 years ago, nobody was coming out. And it's just by few of us coming out that we're making other people see you can come out. And before they will know it, we will be the noise by the grace of God. Let me ask you this next question, and then we'll take a break. So as the president of NEPISIN, that's people, the network of persons impacted by cancer in Nigeria, what would be your most pressing issues, apart from the ones we've talked about, that cancer patients are facing? And how is the network working to help survivors' voice be part of a solution? Because I don't believe that we should continue to nag and complain. No. What do we want to do to change that? Because we can't keep doing that. This is our last program for this one. We're going to bang it out properly.
Thank you, Dennis, for that question. Actually, you hit the nail on the head when you said we shouldn't continue complaining. Yesterday was our Cancer Survivors Summit. And do you know what happened at the end? We had about 100 cancer champions present. First of all, what we established was our presence. And that really shook our guests. One of them told us that when he was coming into the hall, he had expected to see people shriveled, in pains, lying down, looking ill. Then he was surprised to see vibrant cancer patient community. That was the first impression. And he even accused NICRA of having a communication, I think a training on communication among oncologists without bringing in cancer champions. He said it openly. He said we should have been there so that we would teach them how to communicate with us. That is what our presence meant to him. Immediately after the conference, we met. I was, seeing all the representative of the DG of NICRA, Professor Ali Gombe, and the next thing he said was, "Gloria, we have a space for you in the International Cancer Week. So you guys should start working on what you're going to present." And these were the things we normally beg, grovel, we kind of fight every time. But this is being given us on a platter of gold because we had a conference, a summit, establishing our presence, telling them we are no longer hiding, telling them we are going to do more. And Denise, I need to put this on quickly. I need to say this quickly. As individuals, we may not do much. But if we are able to get the government buy into our proposals, it goes a long way. The Cancer Health Fund is one of it, even though it's not perfect. But over 1,500 cancer champions are already benefited from it. That is what a good cancer policy can do. If we are able to get it, nobody can from his pocket give you 1 billion. But from 2019 till date, is almost 1.4 billion that has been released for that. And this is what the government coming in can do. And government cannot come in if we, the cancer patients, don't go out and tell them, here we are. So that's it.
I agree with you. We're going to take a short break now, and when we come back, we will continue this conversation, and Dr. B, you will take it on from there. So give us 3 minutes, and we'll see you soon.
Hello, everyone, and welcome back to Cancer Watch. And it's Survivorship Month, and we're talking again with two champions who are making waves and making a change. And together we fight, together we win. So we have with us Esther and Gloria, and just sit right there. We'll go right on now. Esther, thank you again for sharing your truth with us. I do have a question for you. You bring years of nursing experience into this advocacy space. I mean, work almost at retirement by the time you had this challenge. How has your journey as a patient changed how you support others, especially women? The hands-on experience, how does it affect everything?
As a nurse, I'm trained to take care of others. And I looked at it from as a patient relation, it's not me. So I'll just say, sorry, do what I need to do for you, and you go. But when it affects you directly, when I was diagnosed, it became another story altogether. It changed, my whole perception changed. It's me doing this work now. So I need to do not only the talk, I need to talk and work at the same time. Because people will be looking at me, seeing my reaction, how am I coping? So it has changed my perception about everything. It has changed my outlook in life. I take every day as it comes. I no longer have plans for the next 10 years. Yes, I hope for the next 10 years, but I take one day at a time. And then secondly, for the patients also, it has also opened my eyes that I have survived this. I went through this. So I imagine the people are going through the same thing that I had gone through. So there's need for me to reach out to people. Like Gloria said, in the clinic when I go, because there are some silence that are louder than whatever somebody is saying. I look at people, I look at their countenance. Sometimes I just go sit near someone and then we start chatting. I made a friend through the same way at the clinic. And each time we talk openly to each other without holding back. And then another thing that we are doing, for me now, I know the mental health of survivors is very, very important. So each week I have a list of people I reach out to. Talk to them, find out how they are doing, and they are always excited to hear from somebody concerned enough to want to find out how they are doing. So it has helped a lot of people, and it's helping me because as I talk to them, I'm giving them hope. I am sustaining my hope also. So that has helped me as a survivor. And then certainly about our survivors also, this testimonial of one of our survivors yesterday actually hit me because many women have done PMTCT before. Many women come sometimes with bleeding, having blood in their breast, and doctors just prescribe drugs for them, not coming back to find out what actually is the reason. But learning what I heard yesterday at the summit, I'm going to advocate for the women, apart from just prescribing antibiotics, they should also go for screening so as to arrest this thing for early detection and then early good outcomes.
Thank you.
Absolutely.
See how
Go ahead, then.
we can actually get something done in a very different way, because we're going to do our last question now, and that's to you, Gloria, because Esther was able to give us an example of what we wanted. So finally, I want you to give a message to someone out there who has just received a diagnosis or is struggling to hold on. What would you say? And also to our professionals. Now, they're all one sentences, but those one sentences have to be very key, because those are the things that we remember about what for a survivor. So give me 3 sentences. 1, for somebody who's just watched it. 1, somebody who's struggling. And to those professionals out there.
Gloria, or should I go ahead?
To you,
Oh, Gloria.
Yeah.
To you, who has just been diagnosed, I am saying this. Never give up hope. The will to survive rests with you. And to you, our dear medical professional, I want you to see us as the individual and not the disease. It will go a long way in helping us, and it will promote trust between the two of us as we walk with you or you walk with us. That's my last word.
I really want to thank you both, because honestly, you hit it on the nail. Thank you all for watching us. Thank you for joining us, because this is our last one for the month. Doesn't mean we're not talking about survivors for the rest, but we are. So as we close, from patient to purpose, can you see, ladies? Can you hear what they're saying about Nepicine? There's Coburg Cancer Foundation. There are quite a lot of us. Reach out to us. What a journey. These are not just stories of survival, but they're stories of impact, of systems being changed from the inside out by the very people who live it. As for Survivors Month, let this weekend and let this be our takeaway. Survivorship is strength, advocacy is healing. The voices of Gloria and Esther and all the survivors we've had all month, we're going to say to you, we are all shaping the future of cancer together in Nigeria. I take this also to say to the First Lady of the Federal Republic of Nigeria, we really appreciate your fight for cervical cancer elimination 2025. We are not going to stop making noise, because that was the stepping stone for us.
Exactly.
Yeah, Dennis, every word you said, true. Every word you said. Advocacy is healing. I mean, survivorship is strength. Amazing. Thank you so much, ladies, at Akon and Coburg Cancer Foundation, and indeed as TV. I mean, we believe in the power of the lived experience, and you have brought amazing language to help us understand what has been going on, and we applaud you for being tribal leaders and speaking up and helping people. Thank you both for sharing your journeys. And to our viewers, we're glad you're there. Let's keep the conversation going. And remember that together we fight and together we win.
Absolutely, Dr. B, thank you. And if you're watching this at a home or in a hospital bed somewhere in Nigeria, newly diagnosed, scared, or tired, please trust me, even me, I've been tired. Let today's episode be a reminder, you are not alone. Your voice matters. Your story can change the future. Laura and Esther, we really appreciate you. Thank you for joining us. This is Survivorship and its platform. Nepicine, we're with you and you're with us. And to all the survivors out there, lead the change. We begin to dismantle stigmatization, strengthen our systems, and demand policies that serve people, not just the system. Dr. B, with that in mind, can you close us out?
Right. Okay. Thank you, ladies, again. We are so grateful, Esther and Gloria. And thank you, everyone, for watching. Remember, this is Coburg Cancer Foundation in partnership with Akon and Plus TV. So please follow us on all of our social media handles. And we hope to see you same time next week. Bye.